Hi, I'm Mary Buxton. I'm a licensed clinical social worker and a certified sex therapist. I wanted to talk today about one of the best kept secrets in women's healthcare, and that is that there is actually treatment available for women who suffer from vulvar and pelvic pain. And often this pain interferes with intercourse, and for some people it's there all the time, whether there's anything provoking pain or not. So the best treatment for this is a multidisciplinary approach involving psychotherapy, sex therapy, physical therapy of the pelvic floor, work with your physician, and a home program. There might be videos, there might be reading, but there is a very active, interactive program to do. And it doesn't always cure people, but hopefully it will improve for most people and cure for some. I wanted to say that a lot of people feel very alone and isolated when they have this problem because they don't know anybody who has it and nobody talks about it. So actually 15 to 20% in the U.S. would be the how often it occurs in the population. And another factor that people often don't know is that people go from healthcare provider to healthcare provider looking to get help. About 10 years ago, I got really interested in this, and I've stayed interested in it, and I've been working with it, and I do work in a collaborative fashion with a sort of team without walls. I wanted to say that what happens for people who are experiencing this problem is that there is a big impact on the relationship. Usually the person starts trying very hard at first and they try to just cope in spite of the pain. They end up continuing to pair pain with intercourse and teach themselves that intercourse is something to avoid. Eventually that gets defeating, one-sided, and they start getting frustrated, so then they start to withdraw. When they start this, the partner often takes that personally and thinks they did something wrong or something is wrong with them, which is not the case usually. And sometimes there's irritation or there can be depression that occurs because depression often goes with chronic conditions anyway. And eventually the affection dries up. People stop talking because don't have the words often to talk about this type of problem. And they come into my office for the first visit feeling very estranged and stressed. So that is where we start. So one of the first things I do, and I'll tell you right now, is to try to restore boundaries about how far you go, but to try to restore affection and intimacy so that you actually have a ground floor to build on. This is really hopeful work and challenging work, but it's great to know that there are services out there. On my reading list on my website, you'll find books and programs related to this problem. And if you feel you would like to talk to me about it and find out what level of services might be useful, give me a call. We'll talk about it. Thank you.